Good morning. My name is Jessica Bland. I am a student at Waynesburg University. This presentation is for Nursing 427, Leadership and Management in Professional Nursing. There are many activities that I have participated in while working through the assignments within Nursing 427. I attended weekly huddles held in the case management department at the Washington Hospital to discuss current developmental changes within the department and challenges that the department was facing. Problems were identified and solutions were discussed during these meetings. As a case manager, we meet on a daily basis with patient care coordinators or PCCs, physicians, and social workers on each floor to discuss patients who will be discharged that day and any challenging placement issues. TDI training is mandatory for all employees in the health system, and it identifies key elements of the lean model for the healthcare system. I had the opportunity to review the departmental budget and brainstorm with my manager to identify areas where the budget could be lowered. I discussed the hiring process within the department with the director and the manager. Each week, patient satisfaction scores were reviewed on the unit where I work, and we brainstormed ways to improve patient satisfaction, which in turn improves the reimbursement for the hospital. Reimbursement is based on satisfaction scores. It's a Medicare initiative that's been adopted throughout the healthcare system. The activity that provided the most learning for me was the lean model reviewed during the TDI training session that I attended. I gained knowledge by viewing the departmental budget and identifying areas that could cut costs. Per Gerblani and Popesky, the lean management module involves the transfer of responsibilities, duties, and tasks to workers who add value to the outcome. This was important in identifying ways to manage resources. Resource management, per the lean model in Murray 2017, assumes that all processes contain waste and involve the thought process of doing more with less. And that's how the lean model was explained to us during TDI training, doing more with less. I learned a lot throughout this course in regards to resource management. When the COVID-19 pandemic occurred, the hospital began pooling resources for PPE equipment from local businesses, such as the casino. The casino was closed due to social distancing and currently remains closed. All the PPE equipment that they had, they offered to the hospital, and that included gloves and masks. Working in a community hospital does have benefits. The community has really pulled together during this time of crises. For the first time in my nursing career, I experienced layoffs within my department. As a nurse, I always expected to have job security. Unfortunately, with social distancing, the number of ER visits has plummeted. All elective surgeries have been canceled. Elective surgeries produced a lot of revenue for the hospital and kept many nurses employed. Currently, at the Washington Hospital, there are 2 entire floors that are closed. From other personal communications, local hospitals around the tri-state area are dealing with this. WVU and St. Clair are experiencing similar issues. The layoffs came on a week-by-week basis. Our schedules on a week-by-week basis as well, too. Prior to being laid off, every department within the hospital started cutting back on staff. One way to decrease staff and manage resources was by giving employees the opportunity to use PTO time or paid time off. Managers were also approving time off without pay. This was financially allowing the company to not begin the layoff process. Unfortunately, this only worked for approximately 2 weeks. Cross-trained employees within the healthcare system were moved around the hospital. Voluntary layoffs were accepted. Out of approximately 30 employees, 18 people within the case management department either took a voluntary layoff, an involuntary layoff, or went to a different area in the hospital to work. The manager and the director of case management did the absolute best they could to reserve the resources that were available and to avoid layoffs, but there was no way around this. Cross-training is an example of resource management. Unit secretaries and nursing assistants have started to cross-train to do one another's jobs. The new term is care partner. With new responsibilities being placed on these individuals, they can choose to become a care partner, and they have become very valuable to the healthcare system. They were able to do more than one job, multiple different tasks within their scope of practice. Um, in the study Readiness for Change and Job Satisfaction in a Case of Lean Management Application, it's identified that these employees are perceived as strategic resources for productivity improvement, and they're trained in a special type of quality control and problem solving, and that's what cross-training does. It's a resource management tactic in order to make not only the employee more valuable to the employer, but they're more marketable if something would happen that there was a job loss. Resource management occurs on a daily basis also when nurse managers establish the average daily census on each unit, and then they decide how many full-time and part-time employees are required to care for the patients. During the COVID-19 pandemic, PPE equipment management became very strict. N95 masks are to be used up to 1 week, if not longer, as long as they're not soiled on the inside. In the past, the masks were just saved for the shift and then thrown away, but now they're saved for a week. So the face shields and eye protection are also being wiped down after each use. They're not to be discarded. They're placed in a Ziploc bag with the employee's name on them and to be used unless damaged. There's also one designated COVID unit. The same employees are providing care to the patients each week in order to decrease exposure. Another aspect of leadership is identifying what materials are necessary and where there is waste. And this is where, during the COVID-19 pandemic, this has become very important. Also, time management and identifying how much time nurses on the unit are spending at the bedside versus how much time they're spending searching for materials is extremely important to identify areas where time management can help decrease the amount of materials being used and searched for and increase the amount of time at the bedside. So I've learned that materials and time do coincide in nursing, and Jeff Forensic writes in his article, Time Well Spent Assessing Nursing Supply Chain Activities. Nurses spend a lot of time gathering materials from the unit and looking for supplies. He suggests that nurses and materials management personnel work together to decrease the nurse's time on the supply chain duties and improve the time the nurse gets to spend at the bedside. He identified that nurse managers and materials managers work this out in such a way that there's better time management and reduction of unnecessary resources. Nursing leaders are in a position where they may be able to contest the unnecessary waste of time and resources. Strengths and opportunity for growth within the department in case management, where I've done my preceptorship, are ongoing. A quarter of the staff of the 30 staff members are cross-trained to do other jobs within the health system. It would be beneficial to cross-train at least half of the staff. Being cross-trained makes employees more valuable to the healthcare system and can help maintain employment. There are some areas where the department could downsize through cross-training. It's important to keep this in mind if there's ever a budget reduction. Another strength in the department is our strong leadership. The director and manager lead the department authentically. They do what they can to make the department more profitable to the healthcare system, and that's very important in maintaining the department and all the employees within the department. Resource management is important to the field of nursing in order to allow healthcare systems to be more profitable and remain open to provide care to the community that it serves. Employees with strong leadership skills know how to manage resources in such a way that the departmental finance goals are obtained. Resource management adds opportunity for growth, which in turn improves employee satisfaction and improves the healthcare system. Please note the resources that were used throughout this presentation. Thank you.